This segment of Delmarva Life is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
Let's talk about pain. We've all had it. It comes in varying degrees, and for some, it can be chronic. Now, treating pain, it can be tricky. Not everyone can handle powerful pain medication. And these days, no one wants to take the chance of becoming addicted to painkillers. In some cases, a procedure called platelet-rich plasma injection therapy can give patients relief. The doctors at Thomas Podiatry use it and are seeing results. Complications from a foot injury and a few surgeries have John here looking for help to heal.
We've done everything, checked his labs, I've talked to multiple physicians, and we've just had a hard time trying to figure out why he's not healing.
So Dr. Monis is turning to platelet-rich plasma, or PRP, therapy.
Platelet-rich plasma, or PRP injection therapy, is a procedure that we can do for multiple types of musculoskeletal conditions.
At Thomas Podiatry and Associates, PRP therapy is used for things like plantar fasciitis, tendon tears, muscle tears, and ankle sprains, just to name a few.
What it does is it helps to enhance the body's healing ability.
Here's how it works. A patient's blood is taken from another area, such as the arm. That blood is put in a machine to spin.
And what it does is it separates the platelets from the plasma. So the plasma is the liquid portion of the blood. The platelets are your clotting cells, your healing cells that bring growth factors into the site.
Once the blood is separated, the platelets are extracted and injected back into the patient. For John, that's the foot.
A lot of athletes have this procedure done because it's very quick. You're using your own blood cells. You're not having to be concerned about having to obtain some type of amniotic cells from elsewhere. And it's a pretty easy procedure. We can do it in the office. It can be done in surgery. It helps with a lot of the the joint and musculoskeletal type of ailments that can happen with any type of patient, especially the athletes who want to go back right away or try to get back into their game as soon as possible.
As far as when relief is felt, Dr. Mona says it may actually feel worse before it feels better.
You know, everybody's different. The thing about PRP is that it actually puts you into an acute inflammatory response. So what's going to happen for the next 7 to 14 days, he's going to have significant pain and swelling because it's actually restarting the whole cascade of healing to try to override the chronic inflammation and pain that he's had.
That means John can't ice his foot like he normally would for pain and swelling, and he can't take anti-inflammatory medicine.
I've had patients who, by the next day, they're like, wow, I feel really good. Or it takes a couple days and they're like, oh, it was awful for the first 3 to 4 days, but wow, I'm feeling really good.
But Dr. Mona says the risk factors are minor compared to steroid injections or long-term pain medication use.
I've got patients who've had multiple injuries, multiple surgeries, and they had 2 injections and they are good to go. They have their brace, they're happy, they've completed physical therapy, they're not in pain anymore.
And like Dr. Mona said, different patients have different responses to PRP injection therapy. Some get relief pretty quickly, while others might get worse before they get better. Now, coincidentally, I saw John later that night and he was doing great. If you would like to read more about PRP injection therapy or to learn more about Thomas Podiatry and Associates, go to our website, delmarvalife.com.